two things we need to think about. One, the finance aspect, other the patient aspect. When we see a patient who's following up for you after initial visit, it's like 15 minutes of the visit. In that 15 minutes, I'll give you the structure, which I don't know where this 15 number came from. I'm really searching that 15 number, from where does this number came from. The patient comes from the room, from the front desk. By the time he walks towards the vitals area where they check the vitals, their 5 minutes are done. 5 to 7 minutes are done. By the time the MA, the medical assistant, talks to him about the medications, refills and everything, the 10 minutes time is done. By the time the patient is handed over to me, 12th minute I get the handover of the patient. And I have 3 minutes. By the time I need to walk from my desk to the room, right? At least it takes time for me 2 to 3 minutes. So 15 minutes really, it does not sufficient for us. As a primary physician, what I struggle is like when the patient comes with 6 to 7 troubles. So initially when I started my residency, I used to go ahead, talk a lot of time to the patients. I used to back out, like every time my clinic used to be like 30 minutes, 40 minutes, 1 hour I used to be extra in the clinic. I need to work there 1 hour more. Then I used to leave 1.5 hours. I used to come home, chat again. I used to not chat or anything over there. So that eventually one of my providers told that, see, talking to the patient, educating the patient, that's a good thing. So you can see, just divide it. He has like 6 medical problems. 2 of them are very severe that you need to give education. Concentrate on those 2 things. Give him a follow-up visit. Now you're doing labs for him. Give him a follow-up visit within like 4 to 6 weeks or 8 weeks. Tell him to come back. Change something. You talk about the next 2 problems. So that way you can just prioritize your visits. But I remember the time is not sufficient talking to the patients.